Hi, my name is Korre Johnson. I work on the social media team here at Children's Hospital of Wisconsin. Thank you so much for joining us today. I thought today we'd have a discussion about attention deficit hyperactivity disorder. And today I'm joined by Dr. Barbara Calkins, who is one of our Children's Hospital of Wisconsin pediatricians. And she works here at Westbrook Pediatrics. And we're going to take a few minutes today to learn more about ADHD and give some guidance and some tips maybe to parents who are curious about this. So first, I want to introduce you to Dr. Calkins. So could you tell us a little bit about yourself, where you work, and the types of patients you see?
Sure. So I'm a general pediatrician. I've been practicing since 1999, and I see kids from age birth to age 21 for all different conditions, well care and sick care.
Okay. And so just the topic of today's conversation is attention deficit hyperactivity disorder, commonly known as ADHD. So for those who are not familiar with that, what does that mean?
So ADHD is a really common behavioral condition that we see, like you said, in school-age children. And it's usually diagnosed sometime between ages 4 and 16, I would say, is pretty average. So ADHD is a problem where kids have difficulty sustaining attention to tasks or following through on things. They tend to be impulsive, for example, interrupting frequently, and they tend to be very fidgety and squirmy or hyperactive. So.
Okay. And as I understand it, it's pretty common, right? Like about 10% of school-age children have ADHD. How is it typically diagnosed?
So ADHD is diagnosed in several different ways. Okay. And first of all, ADHD can be diagnosed by pediatricians, psychologists, neurologists, or psychiatrists. In pediatrics, what we do through Children's Medical Group is we start by bringing the families in and interviewing both the child and the parent, see what the concerns are. And then there's very specific diagnostic criteria that the kids need to meet to be diagnosed with ADHD. So we start by providing the family and the children with validated ADHD behavioral tools that there are checklists or tests that they would bring to the school that the teachers that are involved in their care at school would fill out, and that every family member that's an adult would also fill out. Once we're done scoring those, we also would review the academic records from the school, and we would request that the school psychologist do in-class observation to help us get a better picture of if the child's behaviors are out of the norm of what their peers are doing in the classroom.
And so can you help me understand, what are some of those behaviors? What are, I guess, parents looking for as a doctor? What are you looking for as far as identifying if this might be ADHD? Okay,
so again, very specific criteria. So when we look at inattention, for example, okay. These are kids that in the classroom they're daydreaming, they're not really paying attention. Or when they're told to, for example, bring homework home and return it back in, they're forgetting to do both of those things. They don't bring it home, they don't hand it in. They're just very forgetful, I would say. The hyperactivity part, again, kids who are constantly on the go, excessive talking, excessive squirming and fidgeting, and the impulsiveness. So these are kids that they're trying to stand in line, they get angry, they push the child in front of them. They're trying to raise their hand to answer a question, but instead they just blurt it out.
Now, kids are going to be kids, right?
Right.
I have a toddler at home, and
sure.
So some of these behaviors might be common for just any toddler, any
sure.
Adolescent, but there's, maybe it's exaggerated or maybe it's slightly different, right, for a child that's ADHD.
Right. So, one of the really specific criteria to diagnose ADHD is that this is a condition that starts when the child is young. So usually the onset is under age 7.
Okay.
And it's something that persists through into adulthood.
Mm-hmm.
So when children have ADHD, you're right, some of these behaviors that you've described that we see in toddlers, that they do have some of those behaviors, but it's way out of the range of the norm for their peers. So these children who have ADHD, their behaviors are so disruptive that it's causing problems at school. They have difficulty with making friends or sustaining friendships. They are really struggling academically. So they're intelligent, smart children who just can't do well with testing and with grades. And it's causing significant stress in the home with the family. For example, even something simple like dinner time, where family would sit down to eat, the child's up and down constantly, out of the table, can't complete a meal, or they're standing at the dinner table trying to eat because they can't sit down. So I think that when a child's behavior is so out of the range of normal, it really impacts the child and the family negatively in all aspects of their life, both in their school life, their home life, and socially.
So it sounds like the observing this behavior and maybe coming up with a diagnosis of ADHD happens earlier in a child's life rather than later?
Yes, that's correct. I mean, ideally, anyone we're evaluating for ADHD, it's a behavior that families have kind of noticed all along. And this is usually brought to our attention again early in the school age years. Sometimes we do have teens that are coming in that are concerned about symptoms of ADHD, but when looking back through their life, we know that they've kind of struggled with things throughout grade school and kindergarten. It didn't suddenly start as a teenager, it didn't suddenly come on while they were in college.
And it sounds like the role you have as a pediatrician can be very important in helping a parent understand maybe what this behavior means and maybe getting the resources and the help the child needs. Is that right?
That's exactly right. So, one of my jobs as a pediatrician is to do just that, is to help the families understand what's considered normal behaviors, and then helping to facilitate the testing for ADHD if that's warranted, and then once we're done testing and scoring, to re-meet with the family and the child and really go through explaining with the family and the child what this means. And I really think our goal as a child's pediatrician is to help that child be the very best that they can be. And I think there's a lot of negative feelings around ADHD because these poor children aren't choosing to be doing naughty behaviors. Kids don't want to hurt other kids. Right. Kids don't want to be considered bad all the time. They want to please their teachers and their family. And we know that the kids that have ADHD, again, we know they're smart and we know that they're great kids. And so we want them to be the best they can be, and that's why it's important to get the right diagnosis so we can get them the help they need. And whether that's medications or therapies, but we want them to shine and have a good self-esteem.
And when you interact with a parent who may be concerned about this or might be hearing about their child maybe having ADHD, is the parent worried? Should they be worried? I mean, what can they expect?
I think by the time I talk to a family about ADHD, the parents are definitely worried and stressed.
Yeah.
They're stressed because at home things aren't going well. They're stressed because at school the teachers are calling them constantly because their child's doing negative behaviors.
Right.
Or they're stressed because their child's sad because they're having problems with friendships. So I think parents are worried. I think they're overwhelmed and stressed. But really, ADHD is a condition that's very treatable, and children do really well when they get the proper treatment, and they're very successful.
Is there any advice that is generally very helpful to parents with ADHD that you could provide? If there's a parent out there watching right now who has a child with ADHD, what type of advice do you typically give those parents? Or is it really specific on the child?
I do think it's specific to the child. One of the big things with ADHD is just making sure that your child is well supported. And what I mean by that is, I think if there's problems in the home with trying to figure out how to, discipline a child or get a child's family life regulated so they can get through the day successfully, this is where behavioral therapy is really important. And behavioral therapy can be done in private psychologists in the area. It can be done through the school psychologists, but it helps families and kids with problem solving and how they can be the best they can be. Parents can be also advocates for their child through school because schools make lots of great accommodations for kids with ADHD to make sure that they're, sitting in front of the classroom, having lots of time to take tests. That their homework is broken up into smaller chunks so they just can be successful in what they do.
Dr. Calkins, we just had a question come in. Is there any resources that you would recommend for a parent to reference when they're looking for additional information on this or?
Yes. So first of all, just if you like to be on the internet, the American Academy of Pediatrics, which is aap.org, is a really, I think, just a useful website for any pediatric topic. If you put in their search engine ADHD, the American Academy of Pediatrics has tons of books and articles online that can be used. There's also a really supportive group. It's called CHADD, and it's spelled CHADD. If you put that in just a regular search engine, you'll find that that's a support group and wonderful information on ADHD for families with children.
Great, thank you.
I just have one more question to wrap up our discussion today, and it's about any common myths that are out there about kids with ADHD. And you may have heard a lot of this as you interact with parents talking to you about this. I mean, are there any common myths out there that you think are worth kind of explaining or talking through right now to help clear up?
You know, I feel like there's a lot of guilt when parents bring their children in who have ADHD. And I think it's important for families to know that children who have ADHD, they don't have that because there's been bad parenting or a parent's done something wrong with the way that they've raised that child. And it's not because of something that parent did when the mother was pregnant with the child. I think we know that ADHD, there's a lot of things that we feel contribute to it, especially genetics and family history. And we know that certain medical conditions predispose kids to it. So I think that parents should just know that it's not their fault that a child has ADHD. It's not the child's fault. They're not trying to be doing things that aren't good. Kids, again, want to be good kids. So I think those are probably some of the bigger myths out there. And I think the other thing important for parents to know is that I feel like the pediatricians at Children's Hospital are very careful with making sure that we get adequate diagnosis of ADHD. This isn't, so along with the myth, we don't just have families coming in saying, geez, I think my kid's really hyperactive, I can't take it anymore, can you prescribe a medicine? We go through a lot of trouble to make sure that the kids get adequate testing and that we're eliminating other causes that may make a child appear to look inattentive or hyperactive. For example, do they have learning disabilities? Do they have anxiety or depression? Or do they have a sleep disorder that they're so sleep deprived they're just appearing to have that? So I think doctors do really try to do a good job making sure the diagnosis is adequate, so when we do provide treatment, whether that's therapy or medications, that we're definitely going down the right path for those families and we're not just handing out scripts to whoever wants them.
As a pediatrician here at Westbrook Pediatrics, can you describe how important it is to have a relationship with the specialists at Children's Hospital Wisconsin when you're working with parents of kids with ADHD?
Sure. So one of the things that is really neat about being a pediatrician affiliated with the Children's Hospital of Wisconsin is that the psychologists and the psychiatrists at Children's Hospital 100% support all of the mental health care that we give to children and adolescents. And what I mean by that is that they have a unique system that allows any pediatrician affiliated with Children's Hospital to either page them or email or call them by phone any time of the day, 24/7, to get immediate advice. And that in turn allows me to manage all of these children with just exceptional care. And it allows me to almost be an expert in the topics of ADHD, anxiety, depression, and all kinds of mental health problems because we're so supportive by them. And so it really, I think, is one of these things that because Children's Hospital gives us so much support, it just means that parents, families, and the children are having excellent care and better outcomes. They do great.
I did have another question that came in as well. I'm thinking it's a myth, but it's a common misconception about foods and the consumption of how much food you consume can cause ADHD, is that correct?
That is correct. And this is a topic that is controversial because there needs to be a lot more medical studies that are done on, the role of foods, certain food additives, vitamins, fatty acids, So we can kind of group that into like alternative therapies. In general, there isn't a specific food or vitamin deficiency that's going to make a child have ADHD. On the other hand, I do think some families feel strongly that when they have altered things a little bit in the child's diet, that it's helped. It doesn't get rid of the core symptoms of ADHD, but there are certain changes families can make. But there's a lot of myth that goes along with it. And I think before families go down that path of eliminating certain foods or adding certain herbal medications or vitamins, it's really important to talk to your doctor about it just to make sure it's not going to be harmful to the child.
Great, thank you.
I think that's great advice for everybody watching this, right? If you have more questions about this, about your child, talk to your pediatrician, right? They're a great resource to learn more about this topic. So Dr. Barbara Calkins, thank you so much, and thank you everybody for joining us today. We really hope you learned something. Thank you.